Hi everyone, I'm Claire. I'm a final year veterinary student with UHI NWH and Parisis, and today I would like to talk to you about LENTRA Diploma Level 3 in Veterinary Nursing Small Animals. So those studies are for 2 years and a half and they work in block release, so it's split between college weeks and placement week in a veterinary practice. It allows you to be employed during your study. So your studies are divided between 5 units. And to become a registered veterinary nurse, you're gonna need to pass those 5 exams. So 1 unit, 1 exam. And you also have an assignment at the beginning of your studies. And once you're done those 5 exams, your assignment, you have your final practical exam, which is called the OSCEs, and you need to pass. So I'm gonna talk you through the 5 units of LENTRA Veterinary Nursing so that you have an idea of where you're going to study. So first, Unit 1. So this unit is basically everything about legislation, covering animals' health and welfare, but also the legislation in veterinary practice and where you stand as a student vet nurse and as a registered veterinary nurse, what you can do and cannot do legally. It also covers communication, animal husbandry, so basic of animal welfare and animal knowledge as well, and health and safety. Then you got your Unit 2. So this one covers everything about laboratory, diagnostic, everything about cells, tissue, nervous system, infection control, musculoskeletal system, skin, wounds, all that. Then moving on, you got your Unit 3. So this one will tell you everything about fluid therapy and body fluids. So this includes urinary system, circulatory system, and you will also learn about medicine in that unit. So everything about drugs, how to use them, how to calculate them, and also these units include emergency and critical care. Then you got your Unit 4, so respiratory system, digestive system, reproduction and breeding, what else? Endocrine system, pain management and diagnostic images, so ultrasound, radiography will be included in there. And then last but not least, we've got theater practice and anesthesia. So anesthesia is such a big thing for veterinary nurses that yeah, you got one unit basically just about that to really go in depth about anesthesia. So let's say you passed your 5 exams, all good, you passed your assignments, all good. So on the side of that, you are in placement or working in a veterinary practice, and you need to complete a minimum of 1,800 hours in a vet practice. So during those hours in practice, you're gonna need to work on your NPLs. When you're working, you're gonna have to log everything you do basically, and yeah, become competent and confident. So let's say that you've passed your 5 exams, you've passed your assignment, you've been working in a practice or in placement in a practice for 1,800 hours. You completed all your NPLs. All that is done. What else? Well, the OSCEs. So this is your last exam, this is your practical exam. You're gonna have to learn about 30 tasks, a little bit more of basically what we do, nurses. So yeah, you're gonna have to learn, work on your laboratory task, anesthesia task, radiography, nursing care, communication, all that. And on the day of the exam, you will have to do only 12 tasks, and you have to pass 8 out of 12. So mistakes can happen. So you should be fine. So yeah, this is it. This is LENTRA with UHI NWH and Parisis. If you have any question, please let me know. I will be more than happy to help.